Hello, welcome to vlog number 1 for practical techniques in strength and conditioning. In this video, I'm going to be critiquing two different athletes in two different lifts. In one, we'll investigate the athlete's limitation due to skill. In the other, we'll investigate the athlete's limitation due to capacity. In both, I'll be including what interventions should be taken where applicable. Athletes have been instructed to perform both squat and overhead press, but have received no coaching cues. The idea is to observe them in their most natural movement patterns and assess them from there. So, without further ado, let's begin. Side on, first observation is a minor butt wink at the limit of the athlete's descent. It isn't excessive, however, it is worth keeping the squat depth in check to a point above where the athlete feels the tucking begin to commence. In doing so, the athlete reduces the risk of injury by maintaining spinal integrity, especially when under load. Second observation is the athlete's finishing position. He appears to be finishing his descent without extending his hips. This lack of hip drive indicates a possible inability to engage the glutes. In addition, this causes the bar to align over the front of the foot. As the athlete tries to keep his chest up, this then causes thoracic extension and lumbar extension. Under load, this can then result in injury. Foot placement is focus here. The athlete's right foot sits a little further forward, with an external rotation slightly greater than the left. As a result, the athlete appears to slightly rotate the left, causing the left leg to internally rotate. In addition to that internal rotation, what we also notice is that on the left side his shoulders drop. This may be due to limitations in the upper body, or this may be due to the uneven nature of his stance. What we can also see is an instability within the knees as the athlete hits depth. This is due to the lack of engagement in the glutes. At the rear, I bring my attention back to the tucking. We can see the athlete hits his max depth as a loss of stability occurs in the ankles, causing slight pronation. This can be addressed by reassessing the athlete's squat depth. That pronation also possibly shows a lack of engagement in the glutes. To conclude, this athlete's limitations can be addressed by learning how and when to engage the glutes correctly, and proper coaching of the technical model. Side on, we can see that the athlete has adopted a more powerlifting-based wide stance, thus limiting the range of the ankle. What we see in the limited anterior knee translation in conjunction with external rotation of the foot shows a limited ability to perform dorsiflexion. This in turn causes the athlete to hinge further forward from the hips to gain stability and align the bar with the midfoot. As the athlete attempts to keep his chest up in this position, this then causes further lumbar extension and thoracic extension. We also see slight tucking at the end of the athlete's descent. What is worth noting is the level of the hips in comparison to the knees as the athlete hits depth and tucks. What this tells us is that the athlete lacks the stability and mobility in both the hips and the ankles to perform the more traditional technical model, thus adopting a wider stance. From the front, we see slight valgus and pronation of the ankles, as well as external rotation of the feet. What we see then is not only is the wide stance a strategy adopted to counter poor hip flexion and flexibility, the athlete also appears to lack the glute stability and the adductor mobility to adopt this strategy successfully. From the front on, especially in the final repetition, we can see adduction of the right leg with external rotation of the right foot, causing the hip and consequently the shoulder to drop on the right side. It's worth noting that the athlete has relatively long femurs, which adds difficulty to performing the traditional technical model, causing his limitations to be more capacity-based as opposed to skill. Interventions for athlete 1 including switching his stance to a narrow one, whilst utilising mobility and strengthening on both the Achilles, the soleus and the gastrocnemius, and hip flexors in unilateral application to facilitate the transition. Pole squats will also aid transition by stabilising his hip flexors in a narrower stance. This athlete exhibits good initial spinal integrity as well as fluid movement through the scapulae. No flare in the ribcage indicates little extension through the lumbar and good engagement of the anterior core. In the first few reps, we see the athlete finishes the lift with the bar predominantly aligned over the forefoot, but quickly adjusts to align the bar with the center line of the body and midfoot. The athlete seems relaxed in his lower body as exhibited in his foot position, so should consider engaging his quads and glutes so as to provide a solid foundation and stable foundation from which to drive. The athlete appears again to be extending with the bar aligned over the forefoot. This alignment seems to be preventing the athlete from achieving full extensions, as to do so would deny any stability as the overload of weight through the anterior of the frontal plane pulls the athlete forward. The athlete has, however, exhibited the ability to correct this in previous footage. As such, I believe that the athlete only requires coaching cues to extend through the thoracic and extend through the triceps. There appears to be a significant drop on the right shoulder, which is present throughout, which may indicate the athlete has trouble extending through his thoracic unilaterally. Conclusion: the athlete performs the overhead press sufficiently, but requires minor tweaks to overcome his skill limitations of the technical model. The drop on the right, however, indicates there are some capacities that require addressing, so as not to overstress the spine under heavy load. In order to perform the overhead press, stabilization of the trunk, more so maintenance of a neutral spine throughout the lift is required. While the athlete begins in a good position, what we see mid-rep is a slightly excessive extension of the lower back, causing the ribcage to flare. This seems to be due to the athlete leaning back in the starting position. This lean may be due to limitations in external rotations at the shoulder and posterior tilt in the scapula, preventing the athlete from aligning his wrist and elbows under the bar whilst maintaining a neutral spine. Hand placement on the bar is asymmetric, causing the right arm to appear as if it has dropped slightly in comparison to the left arm at full extension. What is worth noting is the athlete appears to favour loading his left leg slightly in the eccentric phase. If we recall correctly, the athlete's limitations during the squat were of the right leg predominantly, as such favouring the left leg. Reoccurrence of asymmetry in hand placement from the rear view highlights a slight depression at the right shoulder as a knock-on effect. The athlete appears to have the scapulae abducted, which accounts for the inability to externally rotate. Interventions for this athlete entail learning to brace the core and engage the glutes so as not to put excessive extension through the lower back, as well as exercises such as face pulls so the athlete learns to retract and posterior tilt the scapula so as to encourage external rotation. Capacity limitation in the right shoulder, I feel, requires intervention from a qualified physiotherapist, as the drop in the right shoulder seems to correlate with favouring the left leg.